Modern medicine has come a long way. Did you know people in the early 19th century were expected to only live to 30? Now it is more like 70. So is it fair to call this one of the few battles we have won? Not so quick. Did you know we have over 5 million people suffering from lupus today? And there is no cure. There is no cure for lupus, and the few medications that are used to control the symptoms cause almost as much pain as the disease itself. Lupus is a chronic autoimmune disease that can damage any part of the body. Basically, patients' bodies can't differentiate the good proteins called antibodies from the bad ones. This means autoantibodies attack and destroy healthy tissue, causing inflammation, pain, and damage, especially in skin, joints, and organs. When I said there is no cure for lupus, I don't mean there is no prescription. A doctor can give you treatment to slow or prevent organ damages, but the medicine may cause side effects and changes in appearance such as acne, a moon-shaped face, weight gain, and hair growth. Sometimes fluid retention and a redistribution of fat, mostly a swollen face and abdomen. Many have fragile skin, and some suffer growth suppression. If that isn't bad enough, many experience irritability, agitation, excitability, insomnia, and even depression. Except for the lucky few with very minor symptoms that can just take aspirin or Tylenol, most patients have to take dangerous medicines with severe side effects. And doctors have to carefully evaluate each case to balance the risk versus the possible benefits. Basically, patients walk on a thin line between organ damages or living a life you wouldn't wish upon your worst enemy. You may have guessed, what I described to you are the side effects of steroids. And for lupus patients, it's a drug you can't live with, but also can't live without it. Lupus is a lifelong battle, and there is no chance of any ceasefire. The other medicines lupus patients can take is the non-steroidal anti-inflammatory drugs, also known as NSAIDs. Patients with mild symptoms can take over-the-counter ones like naproxen sodium, also known as Aleve, or ibuprofen, commonly known as Advil, or Motrin IB. Side effects of NSAIDs, whether the ones by prescription or over-the-counter, include stomach bleeding, kidney problems, and an increased risk of heart problems. Another medicine doctors use to fight lupus is hydroxychloroquine, also known as Paclitaxel. Many patients suffer upset stomachs and on rare occasions experience damages to the retina of their eyes. Sometimes it even causes blindness. Since lupus damages organs through patients' own immune system, immunosuppressants tackle the problems by weakening patients' immune systems. Unfortunately, that also makes patients vulnerable to other infections. So, these drugs are used only for serious lupus cases. Now, what is the number one cause of death for lupus patients? Infection. Immunosuppressant drugs include azathioprine, mycophenolate, leflunomide, and methotrexate. Potential side effects include an increased risk of infection, liver damage, decreased fertility, and an increased risk of cancer. A newer medication, belimumab, also known as Benlysta, also reduces lupus symptoms in some people and with less deadly side effects. But that still means nausea, diarrhea, and fever. You may have heard that chemotherapy can be used in some lupus cases. In October 2015, Selena announced her recent chemo-lupus treatment. Although no details were released, I assume cyclophosphamide or methotrexate was used. Cyclophosphamide can cause bladder problems, hair loss, and sterility, while although methotrexate, also known as Rumitrex, is very effective in treating skin lesions, arthritis, and pleurisy caused by lupus. It may cause liver damage and lung infections. If you wonder why people take these medications knowing the possible lethal side effects, the answer is quite simple. Compared with death by lupus, these side effects are really a piece of cake. I never knew how lupus can change your life till someone I love very dearly was diagnosed with lupus. My heart sank when I thought of the pain she had to go through and the long battle ahead of her. However, she told me that she has gone off steroids and with amazing blood test results a month ago. The treatment cost very little, even when you don't have insurance coverage, and the herbs have been in use for several hundred years without any known side effects. This is where she got her treatment from. However, since each case is different, only doctors can prescribe after evaluating each case. But the improvement for my family was so unbelievable. It lit up our hopes and lightened our burdens. You don't need to follow my footsteps, but I have to show you the way. This is Ken Peters. Thank you for watching.